HNEG, hemorrhagic nephritis enteritis of goose. For the general characteristics, it's linear DS DNA, it's non-enveloped, which means there's very good resistance, it's persistent carrier, and it leads to latent infections. It's oncogenic, and it's a hemagglutinin, which means it binds to red blood cells. The virus is stenoxin, which means it has a narrow range. It only affects birds. The virus has four genuses: alpha, beta, gamma, and delta. Gamma affects birds. The etiology of the disease is goose hemorrhagica polyomavirus, GHPV. The epidemiology of the disease. So the susceptible species are geese at age 3 to 10 weeks. Older animals are subclinical. The disease also exists in ducks, Muscovy ducks, and wild geese, but these are mainly asymptomatic, but they can shed the virus. The virus is shed in feces and respiratory discharges. The virus is also a hemagglutinin for chicken red blood cells. It is not a germinative virus, but it can still spread on the surface of the egg. The pathogenesis. So the infection occurs through pros or intranasally. This then leads to viremia. Then the virus binds to B cells, and the secondary replication happens in number 1, the blood vessel endothelium, number 2, the kidney, and number 3, the intestinal epithelium. The clinical signs are acute. The incubation period is 6 to 7 days, and it affects animals that are 3 to 10 weeks old. The mortality depends on the age. It can be up to 100% in susceptible goslings. The clinical signs are a shaking head and neck, diarrhea, lethargy, and coma. In chronic cases, you can see uric acid crystals, which affect the arteries and the kidneys. Pathology is hemorrhagic nephritis and gout. It can also cause necrotic hemorrhagic enteritis. The virus also causes hepatitis and ascites, which leads to edema. In the histopathology, you can see interstitial nephritis. The diagnosis occurs through looking at the clinical signs and the post-mortem. The virus can be directly detected through a PCR. However, isolation is difficult, but it can be isolated in an embryonic egg. The virus can also be found indirectly through the ELISA test and hemagglutination. For treatment and prevention, an inactivated form of the BFDV virus, so the Bujovigar fledgling disease virus, gives cross-neutralization. This is a polyomavirus disease which affects parrots, finches, and falcons. The vaccination is given to the breeder geese 6 weeks and 2 weeks before hatching. This vaccination can give 3 weeks of maternal immunity, and then the young geese are vaccinated at 3 weeks old and 6 weeks old.